to 9. 8 to 9.
And review. Okay, don't worry. I'm gonna start with page 1.
Page 1.
Okay. The review for you, okay? Good morning, everybody. It's a long time no see.
Yeah.
Okay, this semester we have the self-care advisor, the disease prevention. We study the post semester, right? Post semester we track the nutrition, physically, mind medicine, and also this semester we had a totally this overall maintenance, the self-care, because we have the conventional medicine, but we have the other way. Yeah, so we try to do this the course. If you want the emergency, the first aid, the CPR certificate, I give the chance for you, okay? So you can, maybe if you want, maybe last week, we called the supervisor or instructor, they give me maybe 4 hours, then you get the certificate, okay? Okay, so today, review the first page, the self-care and the disease prevention. Overall, you got to take care of your health because we have so many issues in the home, in the office, and the job around or your school here, right? But the conventional medicine is made by the medical doctor, the physician. So you can touch, but you can buy self, you can maintain it by self, the natural made or over counter or supplement or natural remedy, right? So today, so you can see the first page 1 and to 8 is the discovered and these are the evidence of the test book. So many people they try to the natural way, but because of so many people suffer from so many drug, the side effect. So you have to avoid some side effect or reacting the metabolism and the drug metabolism reaction. So you have to know that you have to do basic role and more to save your overall maintenance of your health. So many people go doctor when they don't need it, right? But sometimes you're sick, right? You have to go the other way, the physician or medical professional, or you want to stay your home, you research the internet or YouTube or some you have the guideline, the book, the home. There's sometimes the stomach pain, the stomach flu or something, it's not the emergency. No, maybe injury or car accident, no. Just a simple, the basic, the body sign or vital sign. You can check the temperature or mouth dry or hydration or some diarrhea. So what to do? Go home. Medication, what kind? Over the counter or?
Over the counter.
Okay. How about the cough? The winter time. Now it's winter time, right? So many people the cough and the virus. So what to do? You try to the tea or just you buy the over counter?
Before getting sick, I try to take supplements to
Supplement?
keep my
The
immune
bitter?
system healthy,
Healthy?
and then exercise regularly, sleep well, and if there's sick people around, I try to wear a mask.
Yeah, you remember, right? We first time we semester, you meet me, right? So I checked the quantum analyze, right? The machine, right? We check the nutrition, the state, right? So usually people ignore. Just sometimes, oh, I'm tired. I buy some vitamin or mineral, right? But usually no maintenance overall because why I'm studying for the choice this the tema, the self-care advisor disease prevention. You are okay, your health is okay, the state is okay, but sometimes when you sick and people are looking for the vitamin shop, it's not medicine. It's a vitamin mineral. Yes, essentially we have to maintain every day because the vitamin is not inside here, right? So we just outside coming here. The mineral and the vitamin no balance. Anything maybe selenium, the zinc, copper. They the 3 part plus C and the T3. They control the gut health and the immune system. So you have to every day you have to try to dose and then vitamin C is overdose okay, but the vitamin D3 or vitamin A, we have to dose, we have to follow dose. But vitamin C overdose, the mega dose is okay. Okay, so this season we had the selenium, the vitamin C, and D3, much better. And then if you take the food, the sweet potato instead of the potato, and then more celery and then beet, beet and then curcumin, they have more digest enzyme. Okay. The self-care advises disease prevention. You can do take care of yourself and your family. Then what is time to call your doctor. So sometimes you have an emergency before you call your doctor, right? Or the fire department, the 911. So sometimes maybe some people that pass out in the home or die because so many the people they choke, so they can the food, right? So maybe 1 minute or golden time they pass out, right? So long time ago the Korean actors, the TV show, they tried the life escape, and he has shocked here, the pathway. So all the time, maybe here, if sometimes the shock your leg here, you can hear push here. Chest here, the belly button here. This one, and then here, up, they come out. But some people take out the hand or it's no good, right? So only the push up, they come out. So you have to launch the little tool of the self-care, the maintenance of the condition. You save your life span. Okay. The people you consider making use of our protocol, this course, you should know something about the organization and development dance. When she is medical disorder, diarrhea. For example, diarrhea. So diarrhea, we have 2 kinds of diarrhea, right? Maybe your food poison. Maybe you have pain and more nausea, and then you're tired, the vomiting, and then they come out because we electric water, and then the minerals they come out. So maybe you have the sufficient hydration and or cornstarch. The starch food is much better. The cornstarch, right? So cornstarch or the corn and sweet potato and the yam is much better for the diarrhea. Or the other diarrhea, maybe you put the cool food. Maybe we have hot food, the cool food, right? The winter time, maybe let it in the ice shake, the popping soup, right? Maybe it's good or not. It's no good because your body is very cold, and the cool food you take it, maybe more diarrhea because they want to keep the temperature. Okay, so but summertime, the winter time, you have to be careful the diarrhea too much occur. So you have the water, the hot water, and then the cold water. This is the 음양탕 here, the cup, right? So the hot water and cold water. The summertime, winter time, Yeah, because this Chinese diary, the plus minus. Yeah, so this temperature, because this one, the temperature, your body temperature, the warming up. Yeah, so summertime, don't too much drink the cold water, ice water, and winter time, don't too much the hot water. So this help this water good for the maintenance of the gut health. Okay, so we prevention the diarrhea too. Yeah, page 2. This is a study that published in the British Journal of the Cancer 2002 showed that when continues with the administered colon cancer, the patient the suffer cold improved by almost a fourfold. Yeah, because we have so many colon cancer. Yeah, you have a Lordland, right? Lordland. The human skin. Yeah, usually we have a problem. Yeah, with obesity people or some the digestive people, the pancreas problem, they have this one. They change the shape, so they change the M. M is no good, the shape, because we have it here. It's good, but M, because they have a problem, colon problem here. So we had the traffic here, the concentration here. So usually people dehydration. So they have a problem. Maybe good hydration, they easy flow here. With the dehydration, they step here. There's a traffic. So the body here, this side, inside here, they stay here. So they stay here. Maybe they easy colon the tumor or the cancer. So we have to keep this norm. And usually here, no exercise here, too much the protein and the fat here. They change the M. It's more the colon cancer here. Okay. So also the small intestine, the function, the small intestine, maybe you did outside come the nutrition coming in. Yeah, small intestine they absorption, they give the liver and then gallbladder. They make the enzyme and then they make more digest and they make energy too. So this part is very important here. So that they have the evidence of the Cancer Association in 2002. It's life vegetation funded research. The mission of the life vegetation foundation to support the research and the getting control over aging the girl. So aging. Okay, aging is a disease or natural? How about things? You're 32, right?
Sorry.
30. 28? Okay, I'm 53. Okay. 28, 30, and then 50. It's a natural or disease? Natural or disease? Okay. How about the blood cancer? Breast cancer. It's a disease or natural?
Disease.
How about diabetes?
Disease.
Disease? Okay. Yeah, hypertension or diabetic or high cholesterol, everything is more disease, right? The code number. But aging before is a natural, but now aging to have the code number. It's a disease. because anti-aging, because before 2000 and 2024, we have the reported lifespan maybe 80, right? Maybe 75 or 80 is old. Your dad, your grandpa, maybe live a long time. Yeah, because of 80, right? Yeah, plus 80 here. 2024, 100 years, yeah. So maybe the before maybe 80, oh, she have the longer stay. But now, 80 years now, passed away, oh my God, she's so young, the passed away. Yeah, they change here. So they change the aging before the naturally, okay, they're 60, 70, 80. But now, aging their digits, because they want more, try the medicine or surgery, they more, the save or continue the longest day. So aging is more the digits. Yeah, calling them different. Yeah, so I'm dizzy, no natural. Yeah, because they want more continue longer stay. Because we have the telomere, there is we the teach the telomere. We have the DNA, right? DNA here. The telomere. The telomere, we have telomere. Maybe here. The long, more, continue more longest. Maybe short, more, early, the pathway. Yeah, so this one, this study, Angelina Jolie, right? Angelina Jolie have the DNA is grandmom's mom is a breast cancer, right? So she worried about, oh, maybe the DNA problem, DNA disease problem, maybe over the 50% over. So what about this? So she surgery before, right? So the DNA and the telomere, they continue together. So we have one diabetic, for example, two diabetic, two, right? The diabetic one, the grandpa diabetic, dad diabetic, yeah, they come in the diabetic. So however, we had to relate the insulin outside. But diabetic 2, you can change. You can change the lifespan, or you can change the dietary, or you try to the exercise or the jogging, and then metabolism, and then also you take a medication. You can save the life, right? But diabetic 1, you have one step to the insulin, so the different. So the DNA digits and the telomere are together. So this is the colon cancer. They give to kids because usually Asian people have the colon cancer, not increase. The before, it's America, Russia. Okay, I ask you something. American, the people, lifespan is long, or Asian people, lifespan more long.
I think Asian people.
Asian people are long?
Yeah.
How about you? Lifespan here. Is it more long or?
Yeah, how long?
Okay. The before maybe 10 years ago, American the people is more colon cancer more high because they shot. Asia is long. So the diet changing. Asian people usually vegetable and rice, right? So Asian people before long time ago we found the industry, right? So very healthy. They're very healthy. But American people they have the meat, right? Meat and then the fast something, right? With the show. So usually the American people they digest very fast. And so the meat they stay not too much the long, they stay the radish thin. But the Korean people in the Korea or Chinese Asian people before vegetable or fruit and more the cover right, the rice something. So very healthy, but they start the meat, the fast food. So they must stay here. It's more the cancer include here. Also they have the American people, they have the appetizer, the main dish, the dessert, right? The soup, you are changing. But the Korean people, Korean people, Korean people they have a side dish, right? Yeah, side dish the soup, and we have a side dish a lot of main dish, a lot of dish. But American, just salad, appetizer salad or soup, yeah, that's stir fry, right? But Korean people bibimbap the combination, so they have more little enzyme, and also they delay the indigest, right? Digest enzyme very low, so they must stay here, the vomiting, and then they have to start. Yeah, so this is the theory and the evidence. The Asian people pay more. This one. So the Korean doctor they say if Korean people want the prevention of colon cancer, you have more vegetable. Back to Eden. It's a more the vegetable fruit. It's more the same with the function of the gut health. So now it's a more Korean people they more increase the dementia because the gut health, the maintenance the very low function, the dementia becomes secondary here. Yeah. Also you have the that is on diet changing the prevention of cancer, right? Page 3. In addition to the genetic research, the life extension foundation funding the study to determine if a various compound available today can extend the lifespan is mice. The purpose of the research tests the potential of the vitamin, the drug, the hormone that being used today by the extension member to contract purpose the merchandising of aging. So the functional medicine we have so optimal health. The before 19,000 or 2000, they usually we have the guideline the health maintenance, eat, exercise, come out, the sleep, very well, right? But now the basic health plan. But now 2004 we have starting the functional medicine and also optimal health. The dietary, the physical exercise here, and the mental health. Also you have emotional. The job evidence, yeah. So we have to check because the dietary we started the testing the detox and they change the dietary plan because so many people, the female, want to try to lose weight, right? The detox. So they basic the dietary they change ketogenic or low carb and also the DC diet. And they have the testing in the details. And also they change the physical before on the jogging or yoga exercise here, but now they have a lot of other material and the machine, right? So very confidence, and then we have more the safe. The problem is not active, the passive, right? Because the active person, active button right here, with the more tries, the more bicep, the machine, only passive. So the machine exercise, very confidence, but passive. It's not active. So if you want to lose weight, you have to active because more the burn energy, right? If you burn fat, the more metabolism, you can make energy, and then body temperature more warming up. They using the fat, so easy lose weight. But only the depend on your machine exercise, the passive. So just the burn calorie, the burn the fat. Okay, we have a syllabus here. Okay. Yeah, also mental health. Yeah, so many people have extreme anxiety and depression. Also EQ, IQ. Before we focus EQ, emotional, right? But now intelligence, this AI, right? AI 2.0 something, right? The before we have the EQ and the more the peace of mind and then more comfortable, right? But now too much stress, the panic, anxiety here, and also the depression because of too many competition, and so they have the simple some people they have set competition more low, and this love is more the depression or the anxiety here. So you have to try to more counseling the people. They try to the CPT and NMP, the practitioner. They try to dissolve the synergy here overall the mental health. So we have to do maybe the graph here, EQ, IQ here. They have it's the age here, 20, 30, 40 here, and this is the time to here. Usually here, 2000 here, they have the more EQ here, but now too much competition here, they come here. Also, they have a problem here. They have a problem. This gap here. There's so many people have the anxiety. Okay. Yeah, page 3. Also, brain does being after just 5 minutes, and we can reversible the sum after that. The paramedics often can't research cardiac patient quickly enough. So this means the golden time. The golden time. Yeah, how about things? Maybe your brain dead. So how much time is the more golden time? You think maybe something injury here. Maybe you stop the breathing, right? So maybe the brain does golden time. How many minutes? You think?
10 minutes.
10 minutes? Oh, you're smart. How about you? 10 minutes? Maybe somebody care. So,
Oh, 3 minutes.
yeah, 3 minutes, right? I think it's 3 minutes, right? Yeah, 3 minutes or 10 minutes or you are robot. Yeah, 3 minutes. Yeah, 3 minutes. Because we are breathing here, but no oxygen here. 3 minutes. They can control all the body. Yeah, so this is the golden times. The 3 minutes here. Yeah, here after 5 minutes, so they try 3 minutes, maybe they stop, the temper stop the pathway, but after 5 minutes, it's gone. Yeah, expired. So expired means you can't control anything. So CPR, yeah, CPR or any the emergency tool is not they did not apply the or no action. So we had that this is why sudden late after sudden cardiac arrest number 5%. So last year my dad passed away, so they stopped the starting breathing, so they want to try the assess and then cardiac, but my family is different because it's all the people which tried the CPR, they broken the bone here. So maybe they can recover maybe 5%. So we are diffused. So we have the young generation people. We had maybe some issue, the injury or something. They have to try more. The percentage more 25% of survival. For the senior people, the less the 5%. In urban areas, the pharmacist can open the research patient within 10 minutes. Yeah, this means it's my town, maybe a bio department or a hospital, maybe 10 miles or 20 miles. But if your urban area, this is the LA downtown or LA Koreatown here, maybe you can reach it in 5 minutes, right? They got emergency, the bio 911 or hospital, not too much power. They maybe the surrounding area. So they more give the same time, the golden time. Also, they can more, maybe probably about 100,000 livers could be saved annually. So very easy. The car accident or some injury, you can more save your lifespan and the more potential or high. But it's my town, it's a mountain area. They have it's my house located 3,000 the high cost, and the bio department maybe 10 minutes, so maybe 7 miles. So and then emergency sometime, they get the ambulance coming in 10 minutes or 15 minutes. So we will reduce more survival rate. Okay, number 3, right? Number 3 is allowing body temperatures. Yeah, body temperatures. Okay, how you relate to your body temperature?
Body temperature.
Yeah, body temperature.
36 to 37, I think.
How about you?
I never checked.
I know, check. You think you're high or low? Over 40? Over minus?
Normal?
No. Yeah,
10 and 8.
yeah, 37 to 5 year, right? Is that normally here? Okay, why I mention about this one body temperature? Over 40 is good or not?
No.
Minus 40? No, right? If you're you take your hand, maybe 100 times more body temperature more high. Yeah, and then you touch the ear, right? Yeah, sometimes you cooking or sometimes you mistake your burn your here, right? You very cold here because our body. It's belly button here, right? Usually we have to keep it cool. the hot. Mean we have more good circulation. Yeah, this is normal. Okay, this one, the plus minus, this one. The belly button here, up, a little cool, temperature is much better. And then the bottom, a little more, the hot, and we are more circulation, and then kidney in the bladder, they have more good function. For change, minus, plus, is plus. For example, the female, they have menopause people, right? They have change their hormone. So they have hot plus, right? Up and down, up and down, up and down. You can sometimes the night times to showing back out in the area because we change the body, right? So the hot plus sun and hormone change here. Also insomnia too, because too much hot, you can the eye dry, right? The dehydration, dry eye, and have too much the dream because the anxiety. And put down here, the female or man, and the prostate and the obese have this not work. So they too much they have the infection here, and then also trouble, no come out, no detox because they have the more easy make the stone, the kidney stone, the breast stone, and then the constant too. So all the time we had the temperature is 30, 36, 30, 37. We have to maintenance good health. But down here, maybe 35. Your body needs some the immune system is very low, and then maybe more down here, the 5 point. The cancer patient they have usually low temperature here. Their body temperature very cold. And then here, the pathway, ice, right? So too much over 40, all the time the 40 over the body temperature, you have anxiety, and then you have the insomnia, and then dry, and then change the hormone. So it's not happy. All the time is anxiety here. So you have to keep the body temperature. You have to every day with this one, and then pick pump, the touch. Also, you have the water, right? The cold water, hot water is the same, the mixed cup, and also not too much caffeine. Okay, it's to keep the body temperature. Page 4. Life extension research came to a creative solution. Why not use the lungs to cool the patient? The lung cool the patient because we have some people the lung inspection, right? Because how I think lung must they have to keep the water or not? It means it's dry or wet. The lungs.
Keep the wet.
Right? Okay. The smoke person they make the tight in the dry, right? So the patient cool temperature, but why some people they suffer from infection, too much water. So sometimes they come out, the mucus come and the water. Why? Why is the lung had to cool, but why have the inspection the cool, the problem, cooling problem? Why? Okay, you sit down here, right? So try to deep hop, right? Deep breath, have the more open, right? The chest open, and then we oxygen will show to we the circulation, right? The change. But it's a better time, better here. We try to deep. It's not easy because no power, right? No energy. Because you stand here, you walk here, you deep hop. It's they open here, so we have more energy, right? But it's lay down the bed, just try to deep up, it's no energy, muscle, everything, the tissue function low. So it's not easy, right? So the water we have to come out, but they keep. so they have so many people in patient. So usually senior people, something happen after surgery or recovery time, or something happen, they usually the lung inspection. Yeah. So we have to keep the temperature by temperature and also the water, the circulation. Since the lungs subdivided into tiny component, and then usually is the work in the blood pressure. They provide excellent opportunity to cool the blood. So here, some people have a problem, the injury, right? Kite injury, so we have the C1, C7, P1, P4. Because very important here, we have a car accident, we have too much press, so they need to change it, twist. The twist here, they try to level here, maybe little corner here, they oxygen the problem, the supply, and then also the oxygen, the supply, the nutrition, everything, maybe block here, they more easy dementia with the Parkinson. Yeah, so you have the spine here, very important here. So all the time you have to stretching, you have to try the stretching and then more. So just if something happen, because they have the pain too. So you try to the scientific medicine and the pain and the suffering we talk to later. Because usually pain problem, they or not is a twist pain problem. Yeah, sometimes body happen, some injury or some the bone something, right? Pain. Usually they sensitive here. So we have to twist, or some people the dental problem, they no balance here. They also here, you can try. Maybe here, the stress point here. So so many people, you're angry, right? How about you're upset or angry, right? So they have more the tight. But problem, with the sciatica people, they have problem, they suffer from pain. With the people, they have the strong here. The mouth, the teeth, right? The teeth are very tight here. So they usually sciatica people, they have some tight. So if the pain problem is more massage here, it's much better. Okay? So the pain, the connected body, the tissue will lower here. So you have the brain have the table lower and then extra lower that they change and connect the tissue, and then they have the problem, they kind of depress some. So maybe C1 problem, C1, the C7 problem, we told the problem here. So maybe less little twist, more movements are very hard. The big pump, the massage here, some more comfortable here. Okay, the big toe. They connect the C1 to C7. Yeah, so usually the pain problem they started here. And the page 5. The life extension, the foundation, identity the connectable risk factor, the heart attack, such as the height, homocycling, the cell regulated by the cardiovascular. How about the heart of hearts? Okay, heart attack. Okay. Sometimes we have very upset the depression, right? So you can easily smile, right? Yes, no. Sometimes you see the comic movie, the more happy, right? So they have the hormone, endorphin, serotonin, the dopamine, extobin, the four kind of the hormone, right? The plus the happy hormone. But sometimes you see the sad movie, how you are the peer. When you see when you show the sad movie, sad story movie, how's your the heart?
It will become a little bit heavy.
The heavy, it's down, right?
Yeah.
How about you? Okay. Today I give you $1. So you buy lotto. Oh my God! So you got the one first trade. So maybe $1 million. So you happy or no? How much happy?
Very happy.
Very happy. How are you?
Happy.
Okay. Heart attack. Sad person more heart attack or happy person more heart attack? The percentage.
Sad person.
Happy.
Happy? Sad? Yeah, happy. Sometimes you show the news, right? Yes, some people lotto, oh my God, and then, oh my God, really, they go the heart attack. Because too much joy, yeah, too much joy, problem, the heart attack. Yeah, okay, how about, heart attack, the sad people, the depression, right? And the people more, lung cancer.
More long time.
Yeah, lung cancer, the sad people. The joyful problem, they happy person, they more heart problem, heart attack. Yeah, so don't too much happy, don't too much sad. So we are still not okay, right? Yeah. Sometimes the lot of people not happy. Yeah, because easy make money, easy burn money, easy use the money, right? So the percentage, yeah, the high risk of the lifespan. Yeah, so the joy and then the sad, we have the control because mind control, yeah. The alternative medicine has finally recognized the dangers of supplemental irons. The iron. Okay. You need iron or no? The man, the female, you need iron or no?
Iron?
Yeah, iron.
Yeah.
Every day?
No.
When? When you need use the iron?
Menstrual.
Yeah, and then also pregnant, right? The female, yeah, men's or the pregnant. How about the men?
Same as her.
Okay. Maybe we are healthy person. You don't need iron, right? Okay. And then you have a you have a hypertension. You are the diabetic, the high cholesterol. You need iron or no? No. Yeah, you don't need iron. Yeah, because iron. You have here, the pressure here. You have the plug, right? The plug here. And the hypertension, the diabetic, they have the blue thin, right? It's not the water clean. So iron here, they make a plug more, and then the blood here. But the female, the mass problem, and then you trigger, they need iron. Yeah, also the men, they don't need it because take the iron, the hard time with the man problem. Yeah, prevent problem here. So you don't need the iron, so you don't need it. Okay. So only iron. So you have listed by the medical doctor. Okay, iron. At the Life Extension Foundation, Warner is member to avoid the supplement. Way back is 1983. This warning is issued because of the evidence high level iron increase the risk of cancer and then the cardiovascular disease. Until recently, most multivitamin formulas contain high amount of iron. So based over the foundation warning, members avoided iron containing supplements unless blood tests show that being iron deficient. So only the check the blood test, you don't need iron, you don't need it, okay? And then multivitamin. The multivitamin, the single. Okay. You take it every day multivitamin.
Not every day, but often.
How about the single? What kind of multivitamin? Only one bottle?
No, it's a pill.
The pill?
It's
The tablet or the capsule?
vitamin C.
Vitamin C, the single? The single or multivitamin one bottle? One piece.
Single.
Single? How about you? Single. What kind of vitamin? Single. Vitamin C. 1,000.
Yes.
Okay. How about your multivitamin cover or the single? Okay. We have two people. We test the quantum analysis, right? We have the multivitamin. We have a multivitamin with the vitamin, the mineral, and the amino, the CoQ10. So we have the 27 kind of the vitamin, the mineral, right? And then amino, the 6. CoQ10 is the 5, right? So we have the biotin or the penton, everything here. So you where you get the vitamin? The pharmacy or market or from doctor? The over counter, right? Over counter. So you don't know what needs my body is the status of the nutrition, the balance. You don't know, right? By the hand. It's a hand medicine, right? You pick up. Why you take the multivitamin or the vitamin C? Why? Why you take the vitamin C? Yes. Why you take the vitamin C? For what? The benefit.
For health.
The health. Why you take the multivitamin every day?
It's for stronger my immune system.
Immune system. How about you?
Strong immune system, clean skin.
Okay. So you tried at least 3 months or 1 year, or try up and down? Sometime or every day?
Sometimes.
Sometime? Every day. So every day, so you vitamin C every day. So how your body, the pill, it's good? Maybe sometimes you stop the vitamin C, you tire, right? The pill you, yes or no? Yes. How about sometimes you not every day, right? So how often? Maybe skip the 2 day or 3 day, or sometime
4 or 5 times a week.
4 or 5 times a week. So what's the difference? So you take the supplement and you skip, and then how you appear?
No much difference.
So not much here. Okay. We have 2 theories. One is a placebo. Maybe I'm very sick, so I want to try this supplement. Maybe it recovers my condition, and the placebo, right? And then the other theory, at least we don't need a vitamin and the mineral. Why? Because we every day we have 3 times we eat, right? But the problem, 1970, we have the organic food, right? Because not much the pesticide or no hormone or antibiotic, so naturally the palm, we have the value of the nutrition, right? The before, 1 apple is enough the vitamin or the mineral, but now apple 10 you get 10 before 1, the 10 no balance, because they have too much pesticide, the hormone or antibiotic, and then they GMO the change, GMO change, right? So it's a nutrition very low. Okay, here apple 1, apple 10. Before it's organic. Yeah, and then lychee antioxidant, antioxidant, and then multi the vitamin, the mineral, the very rich. But here, tomato pesticide, the GMO, antibiotic, also the we coating the wax something, right? And also plus you drink the milk or not?
Sometimes.
Sometime cheese, right? Cheese. Okay, cheese or the milk, the plus vitamin D or vitamin A, right? You can see the plus A, right? Because and then sometimes the snack too. The snack, the plus A or omega 3, 6, 9 or sunflower oil. So better than rich nutrition before from here. The problem is that we have the only basic here, the protein and the fat and then carbon. Because before we have the cage free, the chicken, right? You don't know, right? I'm born in Korea, right? My child. We have usually the chicken. We have the cage free. So after eat, we give something, right? And then also the pig too. But now the chicken, we have two kind name: the broiler, layer. The broiler mean you can cook the chicken. The layer they only make egg, the baby. But they have the container. So maybe double sided here, maybe two chicken here. They have a hormone and then they no exercise here. Just like the foie gras. Do you know foie gras? The foie gras is a French dish, very expensive. It's the liver fat. The same thing. So they have a problem here. We have the cage free, right? The cage, the free is more the taste good and the more the healthy. But too much here, too much. The small space, no exercise, the vaccine, the hormone, antibiotic here. So we have the chemical, we have chemical, the supplement. So before you don't need a vitamin, the supplement. The before 1970, 1990, right? But here 2024, the balance here is a mild nutrition. The mild nutrition, no balance. Before we have mild nutrition, but we can the choice not too much, only basic the dietary. But now here, too much. The conventional food, or processed food, or fast food, they try to add the vitamin or supplement, so overdose. What's mild nutrition? So now the poor diet, mild nutrition, overdose. So natural multivitamin, the vitamin, mineral, and the chemical multivitamin or mineral, the same thing. The problem, they give they digest the system, right? But the chemical, natural multivitamin, mineral, they absorption, they supply the cell food. But the chemical did not give the cell. Only we have the metabolism here, and they come out. So because we have too much the mild nutrition, no balance here. So you don't need a multivitamin. So if you wanna more maintenance your vitamin space, you can try the the mineral test. But now not expensive. You can try to maybe $35 or $70. You can check the mineral test. The strip is Amazon or some of the supplier. So you can check, or in body too. You can check the vitamin stage. You don't need to hold the multivitamin. Only usually maybe vitamin or ticamin or riboflavin or vitamin C or E, the CoQ10. Maybe depends what is supply is much better. So single much better. Also vitamin C, only single vitamin C. Okay, we need a house, right? We make a house. We have the selenium. We have got health. The selenium, the zinc, the copper, the vitamin C, the synergy plus C. So at least the B12. Maybe are you vegetarian? No vegetarian, right? Yeah, if you're vegetarian, the B12 and the selenium plus C, and then maybe joint problem, the calcium plus magnesium plus C. Okay, so C is plus the alpha. So only vitamin C, only overdose 1,000 or 3,000 megadose, it doesn't work. They come out. So every time we have to keep together. So maybe selenium or the copper or the vitamin E plus C. Okay, and then multivitamin. You have to follow your nutrition path here. So this issue, right? Too much iron, right? So maybe iron, yeah, maybe too much iron, the percentage of nutrition path, the change. So you can see more vitamin E or omega 3 or more naturally the bioflavin, the vitamin C. So maybe you have too much the iron, yeah, diffuse, okay? So no iron, okay? And also the vitamin C, the any kind of nutrition plus C is more synergy, okay? Until most multivitamin formulas contain high amount of iron, right? So this you have to choose the good supplement. The no brand, the brand name. We have the American supplement in this story. 1 million, maybe I think it's maybe so many kind of brand. So the price doesn't matter. Only check the nutrition path. Okay, nutrition organic or chemical. Yeah, you can see the much better, save money and then more benefit. And page 6. Okay, page 6. This course picture is stands for the protocol on the improving the memory, slowing the brain aging, even the restoring natural logical function, the suffering from the sensory. This one, now brain health. So 1970 there's basic the nutrition. 2000 we have the more the multivitamin or the prevention. Now 2024 the functional medicine and the optimal health. The plus now the modern the scientific the research they focus brain health because so many people the suffer from the mental problem. So brainstorming and then brain food. Okay, we have the brain food. Okay, what kind of a brain food? Things. What kind of food or
Walnut.
walnut? Okay. Okay. That's it. How about the Kiko? Jinko.
I think the deep sea fish.
Fish.
Fish, yes, living in deep sea, deep
Okay.
ocean. Yeah,
Oh, really? Okay. The fish.
fish.
How about that's it? Ginkgo and what? How about the sunflower, the pine nut? How about the fish head? There are some people like the fishy head, right? Because some episodes, the Japanese people very smart because they eat the pity heads, right? Yeah, the goni. Yeah, goni something. Yeah. So now they focus to try to research the brain food. Yes. Also because the brain food means no anxiety, no depression, they more peace of mind and then standard. So usually the spice food is a Greek food, not too much the brain food, right? Any kind of vegetable is okay, but usually the detox the food, the beet the brain, cheese mean with good circulation, the chelation, the beet, and the broccoli, and also the parsley. The parsley have the support the digest enzyme, and the more the press, they more supply the oxygen to brain. Celery. The celery is good for the taste of the salty vegetable, and the celery they have the oil from the brain. They more comfortable the mind. So some people depression or menopause people they try the celery is much better for more the mood control. Okay. Okay, and the page 6 discuss future extensive purpose in improving memory, right? And the brain aging, even restoring the total neurological function in those suffering from sensitivity. The brain here, look at the here, finger. Here, the brain. And then also here, the liver function here. So, every time here, try every day, you can check the memory brain, the stomach or the memoryless or the brain health. Try. One finger, try. Yeah. Every day, 10 times. 10 times you touch it here. And also, sometimes you have anxiety, right? Too much anxiety, too much your love is in here. Your finger, you press it here. 1, 2, 3, 4. The other side too. Here. But sometimes you're depression, lazy. So you want to try something, but it's my body is not work, right? I want to more cozy and then more the couch all day. So only this finger here, touch here, or my body, I want to move something. So too much depressed, only one. Too much anxiety here, the other finger, okay? This brain, the connect too. Also the big toe. Big toe, they lost and then they have a headache and then the C1 to C7. So sometimes the big toe massage here, more comfortable, more the fresh air in the brain too. In the brain detox too. Okay? And then sometimes you have pain, your body cold, and then sometimes your body shake, or you're tired, you cover big toes, aluminum foil, and overnight, it's more your body, the more the good. Okay? Page 7, page 8. The American free access to diet supplements. The results with the correction law that's separately displayed on the monitor of the FDA. The FDA, they control all the prescription drug and then in this study, but the supplement, in this study did not touch. The problem, but we have the bottle, you can see the bottle of the vitamin. This calcium, this supplements not treatment to any disease or prevention of it, and then low FDA, right? So you can see the bottle of the vitamin or the backside here. So on the legal front, lab extension continued by the FDA's talented brain, the disinformation, the triple, non-misleading, the sensitive information to the public. The discipline overhauling the victors against in the FDA, in the court and before Congress, large drug campaign to steal the monopoly over healthcare system in the United States. So the drug merchandise industry too much lobby in the countries or the public. Yeah, so they want to try to control the price. But the supplements price is more overheating. So too much high or too much low, but the FDA is not the touch not too much the district. So only they want the view, they make it the DOM or the supplement industry here. So many brands in the United States, maybe 7,000 brand name the vitamin the industry. But now the Trump government they tried to cut the medication the price. Yeah. So but the supplement industry did not touch. Yeah. And because supplement is not medicine, it's food. So over the counter, right? But before the prescription drug, the transfer over the counter. So you have to check because the new medicine they develop new technology, right? So the older medicine they come the over the counter, but they have some kind of issue, the side effects. So you have to worry about it. You have to question. So you can research the over the counter, the before prescription drug or supplement. Okay. The page 9, the scientific medicine. From the research laboratory and beside the books, the picture lower particularly the prevention and the treatment age-related diseases. Some of the therapies discussed in the book have not at the found offset by the mainstream the medicine. Yeah, because we have mentioned the medicine, so we have so many kind of the medicine. Usually I'm it's in my clinic inside the medical center. So many people have the bunch of the prescription drug, the diabetic medicine, the high cholesterol, hypertension, and some the stomach problem. They give to something issue, and they have some insomnia, and then they have the antibiotic. So the bunch of medicines, the mainstream in the medicine, sometimes they suffering from the patient side, and then not too much to cover insurance. So the patient had to the out of pocket. So they want to try to buy the medicine, the cheap, but sometimes they had to cover and then supplement because only the product drug. It's not the covers the health the problem because we have the some you can take the prescription drug you have to support the vitamin mineral. So because poor people they want to try to out of pocket to buy the supplement. So we have a cycle not changing. Also, the life extension foundation elevate the finding of the study for their value in the healthcare and the medicine. When the subsequent advance accompanied the bacteria new approach, it is then the conscious initially increasing the life extension ever, involving the disease prevention, the treatment protocol, the fundraising objective of the book is to encourage the transport of proposed scientific findings from the research area in the clinical setting, where the patient can the medicine. Because we call the concept scientific medicine, because it introduces the transport the scientific elements from the laboratory, from the lines over the care. So some people. What about them? Because we have two patients. One patient, they're too much focused on the medical doctor. So sometimes medical doctor they check blood test and then body scan or MRI or CT scan, right? So something issue. So one A doctor want to talk to the advise the patient, just do it, just do it. You follow this my direction. Maybe the patient want to try to supplement or the other way. They're not allowed. Only very district, only the you follow me the direction. And then the other big doctor try to oriental medicine or the functional medicine and the dietary treatment. Look, okay, I give this patient drug, and then also if you wanna try to the other way, and then but so let me know. So how do your medication and then the follow the supplement or supplemental or the food, then reaction, right? The medication reaction to avoid the time, because we have to the maybe the patient drug after supplement done together, right? So at least between maybe 1 hour, 30 minutes or 1 hour between the skip, and then give it some more metabolism, it's okay. But the application, the supplement, the herb, don't combine the same time, okay? So we have to study to the medication, the follow is very important here. The scientific medicine, from research the laboratory, beside this book feature novel protocol for the prevention and treatment of age-related diseases. Some of the therapies discussed in the book have not been offset by mainstream medicine. Before implementing the protocol, the leader should understand the scientific, the care used to select the data of each database. Every day, many new studies published in the peer-reviewed journal and then liver better about treating disease. So the medicine industry every years the change, but usually the mention the medicine, for example, omega 3 and fish oil, yeah, omega 3 fish oil, right? Do you know that last year government said omega 3 is good for body or not? You don't know?
That it doesn't work.
Long time, omega 3 is very good for the body, right? They announced, right? Announced the pharmaceutical industry or a doctor, they say omega 3 is good, very good for the body. Good. Now, omega 3, it don't work. So the change too. The before egg, right? Egg too. Before eggs, we had to twice we had to keep the breakfast eggs good, right? But now, before too much cholesterol, you don't need to eat the egg every day because we have too much cholesterol. But now they change. You can do. Why? Inside choline, egg yolk inside choline. The choline they control high cholesterol, so you have to eat every day the egg. So this mainstream in this mainstream the medical industry will change, and then because they more change in laboratory. So sometimes you can see the vitamin, multivitamin, the butter. There's a GMP or organic, and then the other thing, laboratory test that take the mark, the mean, because every time they change the nutrition test. So laboratory try to research, and then also they try to the new patient. If I have some the final stage of a cancer patient, they try all the chemotherapy or medication, right, radio, but it don't work. And then the laboratory they develop the medicine. They try to put it here, right? So some people, if you wanna try this one, no charge it. But we shall know this one because we have the new medicine. Yeah, so there are some people try to put it in the chair and the new medicine, but 80% they just final stage. So they don't want to know save the lives and only to check how to apply and how's the activity, the response. So and then there are the cancer patient before the final stage, people to try apply. So now maybe last year and then this is more increase. Yeah, so new medicine, the researcher and the laboratory, and then the new patient, the final of the stage cancer patient, three parts together, and then this market come out, or we have to more keep going, test. Yeah. So this is scientific medicine, and then there's the natural medicine. But before natural medicine from the aspirin, for example, aspirin, usually we have the white cell, the tree, they come out. So usually medical herb, they base the new medicine they from the naturally. So the scientific medicine and then the natural medicine come together, the synergy, and also the combine the medicine. So Ayurveda medicine, the Chinese medicine, and also the beach flower, and then they have the original the naturally, but they make more the chemical, the drug, and then natural the part together with a new medicine. Page 10. The scientific physician. Scientific physician who practice scientific medicine, yet actually when they have about the new topics, their specialist motives than the ability, the new topic for safety, and then especially the patient, the condition. The scientific physician involved the new topic, the major on. So the physician, the medical doctor, they follow the evidence of the science medicine. So, but I will episode because I have the medical center, right? It's my clinic. So I'm the focus on natural medicine, and the Chinese medicine. That topic. Well, medical doctor have before last year he have the kidney stone. So he wanted my medicine. It's a natural medicine. Yeah. So, but he give his medicine, his patient. So they bidding, they give the push the drug. But he tried to my medicine. Why he from the India, so he have the medical doctor, family doctor, but he studied the Ayurveda medicine. So he tried to natural medicine from me, and then the patient have the same symptom, just like my doctor, then he give the medicine. You understand? So we have the smart way because only we depend on the scientific medicine, but sometimes it work, but sometimes it delay. So we have to try the alternative medicine or natural medicine. They'll come together. It's much better. Okay. So don't decide by yourself. So we follow the district, follow the doctor, but we have the 50% is the health care by self, the hormones or by body. Naturally, we have the boost the immune system, and then you can cure biologically, right? But the 50%, we have to check officially. We have to protest or CT scan with follower together. Okay, so maybe 100% of myself care, no. 100% the scientific physician, no. Okay, the help together is more work. The evidence demonstrate the safety offensive, the chance of that the therapeutic effect will be products in petrol patient, the risk of using the new therapy to treat the patient. Also certified that there's new therapy as a scientific physician, they integrate the therapy into individual treatment ligament. The third physician is enhanced using the research of the providing the new studies to help save the liver of the patient. Why this appears to be common sense approach to better medical practice? It is longer no longer common in the clinical setting. The lay people are often supplied to learn how to sell on the breakthroughs, discoveries the human live. The managed care, the bureaucratic over regulation have the regrets the most physician to the place over assembly lines, the medicine. The page 11. The physician learn about new discovery is a scientific conference from medical journals. On the internet, however, the pension of the doctors translate this the knowledge in the innovations treatment for the patient often fail to analyze many established medical advances. In pediatrician, treating the seriously ill patient often utilize many established medical advances. The few physicians, however, aggressive in their evaluation and the treatment of anemia, hence dietary and then increase the mortality. So I taught the two kind of the science physician. A, the B, the scientific medicine, right? Scientific medicine and the scientific physician. Then you have the district. Conventional the medicine. By the blood test, the CT and the MRI. Also, the precision drug and the therapy. This is science physician. You have two kinds. The one kind A, we restrict the conventional medicine. So they are allowed other therapy, any over-counter, and the supplement. And then they don't care the food dietary. Okay. The B doctor, scientific, modern doctor, and then modern scientific doctor, and the functional medicine, the specialist. They give the same. The district, the conventional medicine, and then also they check by blood test something. For plus, in-body, for example, in-body means we check everything, right? Multivitamin, and then also the percentage of muscle, the water, everything is in-body plus the content, and then strip using the pH level or the strip. So here are the strip using here. Also here, yeah, this one the precision drug, the therapy, the plus alternative medicine, and then natural medicine, the herb, over the counter, this one. Okay, and then here, one more, the customized personal nutrition. Customized the personal nutrition. The mean here, the fasting, the detox, and juice therapy, tea therapy, and also we try to do multivitamin, the single vitamin, right? So we customize it. So your vitamin, the mineral, since the vitamin mineral mean by the vitamin mineral different. So only the focus the personal customized. So we have two types, A, B. So the before, this is the more, the formerly the doctor, but here, the modern doctor. And the science B, the medicine plus the functional medicine. You need to change here. And then also, your mental health, the people, some issue that mental health, the prescription drug, and the hospital, in hospital, right? They're in hospital. But here now, they connect the counselor. Also, the people long time ago, alcohol problem, alcohol or medication, the addiction problem, they usually stay here, right? With the hospital. Now here, so many the counselor they divide alcohol and the medicine, addiction, the counselor, and then also the try to the meditation and then yoga. So alternative the therapy, they controls mental health. Also they try to remind the brain health, right? Brain health. And then also they try the supplement. And then the technology and they try to GABA, OHP, so melatonin. Because melatonin, especially melatonin, we have the serotonin and then melatonin the balance. So also OHTP, they try to the enjoy and insomnia and then and also the dopamine, they the prevention of Parkinson. So they try to the scientific medicine Dr. A and then plus scientific Dr. Fusion plus the functional. So, and then also the counselor. So now modern AI, right? 2.0. So now the people, the power in the story and then more benefiting story here, they more more EQ. It's more not too much the mental problem. But now AI the 2.0. So many competition and the cut labor, right? They instead of the human robot, right? AI and then robot, they supply to China, right? I saw the China restaurant, they have the robot cooking.
Yeah.
So maybe 10 robot they cooking and then one the human they check on the system. Also Walmart, the Amazon, they have no store, no camera, only camera, right? Only camera and then they automatically the product with the passport here they charge it automatically. So they do the counter, right? So also the hospital, more robot they have a surgery. So AI 0. AI 2.0. So now, so many people lose job, they stay home, and then they have ability, the self-ability function low, so they have more anxiety, more depression people. So many people now, the physical issue, issue, more increase more mental issue. Yeah. So if you wanna track the counselor or you wanna track the physical science, you study is more blue ocean. Yeah. So many people they need a counseling too. Yeah. Also OBT too. Yeah. OBT too because there are so many have the trauma. Yeah. The trauma. The child trauma, we have two kinds, we have the three. The child trauma, and so the war trauma, and then we have the job. Yeah, because we have the society, right? So we have the social media trauma. Okay, social media the trauma. Okay, child trauma and the sexual the trauma together here. They have a long memory. Do you have a child trauma? Something big or small? Maybe your dad was crying or whatever. You remember maybe okay, you're 28, you're 30. Back to the time machine, the Bible was 10. You memory 10. You're elementary school, right? So you have a friend or fighting or somebody some issue. You memory or no?
Remember.
You have a joy memory or sad memory? You remember
Sad memory.
sad memory? So now so almost 20 years keep going, right?
Yeah.
It's a child trauma. Keep the long time the memory here. Me too. I'm the 53. I have a memory the 5 6 years my trauma. I'm still keep going here. It's a long have to keep memory here. The word. I have a 3 patient. One has the cut hand, the arms, the cut arms. One patient, and then the other patient, the young, and then have the something happen, maybe touch. They obviously something, maybe scrolling. Because he joined the Afghanistan the war, and they cut the injury arm. He has still pain here. You don't have arm, right? But he think he have the arm. He have the pain, the trauma, the war trauma, and the social media. This one. Okay, I'm you're using the Facebook or Instagram? Facebook.
Facebook.
You can see me on Facebook.
Yeah.
Yeah. Okay. I'm every day. Some the other day I'm the word and the picture was on the word and then the Facebook. And some people, I don't like you. Why you step on something, blah 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 something. The answer response, they have a trauma. Yeah. Now the before physically the trauma, right? So you can upset because it's not actually the possible, right? I don't want the trauma, but the possible. But now so social media trauma is active, right? So we try to something the upload something, right? The story, my story, daily story. But some people view hidden watching or some people try good or right? They this one. But active, the possible. The problem, I want to try show it's my daily life or some dancing or whatever. But some people see it's my side, good side. Oh, my friend is all good job or something. Keep going something. But the other auntie can have something long word, right? So usually the actor or singer, the people subside because some people try to unknown the word, right? So they have some trauma, so you have trauma too. You have the possible trauma and the active trauma, and then you have the physical trauma, and then your social media trauma, the different. So now so many variety of the trauma and then disease. Yeah, so it's open. Yeah, so you have to be careful. You have to self-care. So you have to mind the control is very important here, right? Okay, and the 13th, when does drop the blood acid production too much? The casting is generated in the superior attempt to introduce in the cancer cell. Large amount of gasoline can bind to this factor, so to induce the cell to the hyper property. This means long-term protein from the inhibiting therapy will increase your risk of the renal cancer. This means okay, this is a drug and multivitamin or mineral supplement, then herbal tea. Okay, this one, the fusion drug. Usually we have something, the vital sign and the vital sign, the 6 months. It's active, right? It's chronic. So we go into the clinics. The doctor give you this one. So 6 months borderline, and then the blood test. So usually twice, right? Twice the blood test. The before they give test the blood test, and then they give production, right? Fusion drug. After 6 months, they give one more because they go compound. But it's a chronic disease over 1 year, over 2 years, very different. Because they have maybe hypertension, the cholesterol, the diabetic, usually come together. Yeah, and then some people try to the insomnia, they give sleeping aid, indigest, they give the enzyme, they more increase. So over 1 year, they basic 3 of the fusion drug, the plus 4 aid medication increase, and over 2 years they double. Because the body okay is robot. The human is a robot. Maybe a robot the swelling loose, you joint is okay, right? But you don't, no problem. And then battery, we change the battery is okay, right? It's a machine, right? So maybe this part problem, we need to check this part. But it's a human. It's holistic. It's a robot, it's no part. Yeah, so this medication they give to here, the problem here, but our body is all the connect. We connect, our body is connected here, right? The hand and the feet, the head too. So maybe scientific patient, medical doctor, maybe we have a problem here, we need surgery here. But here we connect the here too. Right? So some people they have problem, they more sick. We check the CT or X-ray, oh the problem is surgery here. But the pain or something same the movement to the limit, right? But no problem when you join here, no problem. We more continues more 1 year or 3 years something. But the human, we have a patient drug. The dose keep going, 1 year to 2 years. It's more function low. Yeah, low here. More multivitamin, the vitamin or the supplement, they have the increase the push in the drug. Our body mineral test, the vitamin, the mineral, they finish. So they have increase, they more down. So we need this one, support here. If we support here, we have something done here, it's a maintenance. Maintenance maybe low, right? Maybe support is low here because we can cure something issue, right? but we support the food, herb, the vitamin, mineral, very slow, disease more delay here, right? But maybe not, only depend on 100% here, pay more. You understand? It's slow, right? The slow, because we have the support to the vitamin or something, right? Herb, oriented medicine too. Only the conventional medicine here, not too much the food, only regular diet, on the follow nutrition anything, it's more easy, quickly more down. And then the final, the stage of any kind of disease, right? So this means we long period of the medication does and the treatment, also the keep the nutrition too. Yeah, it's very important here. Here, the anesthesia, the surgical, the production, the protocol reveals how intensive insulin therapy can reduce the acute elevation of the glucose in the hospital setting and then dramatically reduce the monthly. Yeah, so this one, insulin too. The people with diabetic one only depend on the insulin, so every day, right? But now we have more patch too. I have patch too. So we together they more reduce more dosage. So the before 100% only insulin, but now we did it divide and then more less. So it's a more the body organ the function they have more limits. Yeah, the more activity here. Okay. So also thyroid hormone. Yeah, we talked last week. The thyroid problem because we have the female sometimes confused menopause and hopeless, and then thyroid hormone they change the body temperature. So sometimes thyroid hormone people get the patient they confused. Oh, I'm the hopeless or menopause. So we have to check the blood test and then T3, T4, and then total the thyroid hormone, and then also with the medication and then treatment is different. So